What we're certainly seeing at this stage is that each time there is a further wave of the virus, each time there are more restrictions, the mental health needs in the population go up. But whereas the virus comes down after each wave, the mental health impacts don't. They accumulate. Nobody's immune to this. Everyone is experiencing the psychological effects. It is a collective trauma, if you like, that's happening to all of us. But certainly we see a number of groups of people that are particularly affected. I think particularly those living on low incomes, where of course you've got more risk to the economic effects of the virus. We certainly see it in the UK among people from racialized communities, Black and Asian communities in particular, where you have a greater risk from the virus. So of course you therefore have a greater risk to mental health.
Sei in terapia intensiva, lo sai? Tranquillo,
What we know is for people in that sector that there has been a distinct rise in the reported symptoms. And so our recent paper that came out last week in occupational medicine showed that amongst intensive care staff at the end of the first wave, so that's in June and July last year, that actually, nearly 1 in 2 of them were reporting some level of either post-traumatic stress disorder, severe depression or anxiety, or problem drinking. So what we felt is that people who already had mental health disorders, so they might have been suffering with depression or anxiety disorders or more serious mental health problems such as schizophrenia or bipolar disorder, we thought that those sort of people would probably not do well at all with the lockdown and the restrictions. And they too have obviously suffered, the whole nation has, but they haven't done disproportionately badly. And in fact, they probably seem to have fared slightly better overall than people who had no mental health problems at all. I guess what makes this different is that the incident has been persistent, and we are still in it. We do not know when the end will be. And I guess a similar sort of impact was probably felt by many nations during the Second World War and the First World War, I'm sure. So what we know is actually as communities, in communities actually when things are tough, often don't fall apart. They don't have huge bouts of crisis and panic. Actually, people do tend to pull together more.
So at the moment, our best estimate, based on the research we can get hold of and the surveys that we've looked at, suggests that around about 10 million people in the UK will need some support for their mental health. That's against a population of 60 million, so it's an awful lot of people. About 2/3 of those will be people who are already experiencing some kind of mental health difficulty for whom things have got worse. and then about a third will be people who are experiencing poor mental health for the first time, or certainly the first time they've needed to get any help for it.